Otitis externa. Have you ever felt sudden ear pain, itching, or even noticed discharge coming out of your ear? You might be dealing with otitis externa, also known as an outer ear infection. So, what exactly is otitis externa? It's an infection in the external part of the ear canal. Because this part of the ear is exposed to the environment, it's highly susceptible to infections. In fact, it's the second most common type of ear infection, right after otitis media. Otitis externa isn't just one condition, it comes in different forms. Some are caused by bacteria, whereas others are caused by fungi, or, in rare cases, even viruses. And sometimes, both bacteria and fungi can coexist, which makes treatment a little tricky. Let's break them down. 1. Circumscribed otitis externa. This is a localized infection in a small area of the ear canal, usually causing boils or furuncles. It's often caused due to Staphylococcus aureus bacteria. 2. Diffuse otitis externa. Unlike circumscribed otitis externa, diffuse otitis externa spreads across the ear canal. There are various subtypes under diffuse otitis externa. Bacterial otitis externa. Fungal otitis externa, also called otomycosis. Chronic diffuse otitis externa, also known as swimmersear. Malignant otitis externa, this is the most serious and potentially life-threatening form. So, how do you know if you might have otitis externa? If you experience symptoms like ear pain, itchiness inside the ear discharge, redness and swelling, a blocked ear or reduced hearing, and in circumscribed cases, a painful boil in the ear canal, you might have an outer ear infection. Don't ignore them. Consult an ENT doctor. An ENT doctor can diagnose otitis externa and prescribe tailored treatment. Treatment is usually effective once the infection type is identified. Most cases can be identified with an otoscope or diagnostic endoscope. But distinguishing between bacterial and fungal infections requires expertise since both may coexist. That's why self-medication can be risky. Once the diagnosis is completed, doctors start the treatment according to the patient's requirements. Generally, bacterial diffuse otitis externa are managed with oral antibiotics, ear drops, or ointments. Fungal otitis externa, otomycosis, needs cleaning by an ENT doctor, followed by antifungal drops. Circumscribed otitis externa is treated with antibiotics like amoxicillin or coamoxiclav. But this needs a dermatologist consultation too. Chronic otitis externa or swimmer's ear is usually treated with oral antibiotics, plus creams containing antibiotics, antifungals, and mild steroids. Malignant otitis externa requires urgent medical attention, surgery, and powerful antibiotics. Depending on the type of infection, the treatment varies. So, ignoring symptoms or self-medicating can lead to serious complications, including spread of infection to nearby structures, hearing loss, or requiring surgery. The safest step is to consult an ENT specialist. Proper diagnosis ensures you get the right treatment, avoid complications, and heal faster. In fact, apart from the rare malignant otitis externa, rest all are simple infections that will vanish within weeks if treated properly. To know more, please read our article, Otitis Externa, Ear Canal Infection. Link in the description. Stay healthy. Stay happy.